So for the basic clinical exam of the elbow, we're going to first look at an active assessment of his elbow motion. So I'm just going to ask him to flex up, and then I want you to extend. Good, and then just relax. Now I'm going to be testing for a capsular pattern. We know the capsular pattern for the elbow is 4 times more limitation with passive flexion versus extension. So I'm going to come in and I'm going to test here, and I'm going to extend, and I'm going to test the opposite side. So I'm going to come in and test, and come in and test. Then I'm going to come back and I'm going to do a passive assessment with 3 different forearm positions. We've already done neutral. I'm going to bring him in forearm pronation, and I'm going to passively test his elbow flexion and supination. So I'm moving different parts of the radial head against the capitulum, looking for provocation of pain if there's an issue at the humeral radial joint. Then for passive extension, I'm going to test in pronation, and I'm pushing the distal humerus in a ventral or anterior direction, looking for provocation of pain posteriorly. Good. Now we'll look at his active motion with forearm rotation. So I want you to bring your elbows up. I want you to bring your palms all the way up. Good, and back. Good. Now I'm going to passively assess. Relax for me here. I want to compare. And I'm grasping his medial and lateral epicondyles, going at a 90-degree angle to test. And here I'm coming in, coming up, and giving a little bit of overpressure. Good. Here, and coming up. Good. And my last passive assessment is looking at his wrist. So I'm going to ask you to bring your hands together and come down. And I'm looking to see what is his passive motion for wrist extension. And then I'm going to have you do the opposite here and assessing if there are limits that can contribute sometimes to lateral elbow pain, and relax. So when we do our resisted tests, we're going to test elbow flexion in 3 different positions. We're going to do it in supination, neutral, and in pronation. So I'm going to come in, I'm going to start in a supinated position, hold here, don't let me move you. I'm coming in at a 90-degree angle, hold, 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 and relax. I'm going to bring him in neutral, hold, 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 and relax, and pronation. Hold, 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 and relax. And I'm going to go to the other side, looking for strength and provocation of pain. I start with supination, hold, 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 and relax, and neutral, hold, 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 and relax, and pronation. Hold, 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 and relax. And now elbow extension, just in a single, just in neutral. I'm going to block my elbow on my hip, hold here, don't let me move you. Hold, hold, good, and relax. And same thing on the other side. Okay, hold here, good, and relax. So now with testing resisted forearm pronation and supination, we're going to lace our hands together, and we're going to offset our hands depending on the direction we're going to test. If we're testing resisted forearm supination, I'm going to use my thenar and hypothenar eminence directly over the radius, so my hands are going to be offset here. My thumbs stay out of the way. I ask him to hold here, don't let me move you. Hold, 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 and relax. And I'm going to come in and test the other side. Here, resisted supination. Hold, 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 and relax. And then resisted pronation, I come in, and now I offset my hands in the opposite direction, so I'm on the volar aspect of the patient's radius. Hold, 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 and relax. And here, hold, 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 and relax. Now I'm going to be doing some specific testing for the lateral elbow. So I want his elbow in an extended position, and I'm going to turn you just a little bit here. I'm going to come in. I'm going to be starting with my ECRB and L, extensor carpi radialis, longus, and brevis. When I'm testing my extensors, I'm going to have his fingers relaxed in flexion. I'm coming in here, and I'm going to hold. Don't let me move you. I'm coming in at an angle, at a 45-degree angle. Hold, 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 and relax. Now I'm going to test extensor carpi ulnaris. Keep your fingers flexed. And I'm coming in here and hold, 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 and relax. Now I'm going to come in. I want you to straighten your fingers. Actually, I want you to make a little claw for me. I'm going to support your wrist. Okay, spread your fingers apart just a little. Good. And I want you to hold that. Don't let me move you. Hold, 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 and hold. Good. Now let's test the extensors on the other side, and then I'll come back and I'll look at the flexors. So I'm going to have you turn a little bit. Come up. Elbows in an extended position so we maximize the tension on the musculotendinous units. Fingers are flexed. I'm going to test extensor carpi radialis longus and brevis. I'm coming in, and I can come either here or I can use the ulnar board of my hand, whatever's more comfortable. Hold, 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 and relax. And now I'm going to shift. I'm going to test extensor carpi ulnaris. I switch here, going toward my opposite elbow. Hold, 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 and relax. And now I'm going to test extensor digitorum communis. I'm going to support his wrist. I ask him to hold here. Hold, 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 and hold. Good. And relax. And now I'm going to come back and I'm going to test your flexors. So now, this time, I want his fingers in an extended position, so I don't have the finger flexors helping out. I'm going to test flexor carpi radialis. I can either come in here or I can come in here, whatever's more comfortable. Hold here, don't let me move you. Good. And relax. And the other direction, hold, 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 and relax. Good. And I'm going to come back to the other side. Here, elbows straight. Fingers in an extended position, flexor carpi radialis. Come in, hold, 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 and relax. And then I'm going to test flexor carpi ulnaris. Here, good, and relax.